Yes, today class we are going to look at HHS, hyperosmolar hyperglycemic state. We are looking at HHS, which is simply hyperosmolar hyperglycemic state. So today we are going to look at this as our topic under Diabates mellitus. So what is hyperosmolar hyperglycemic state? This is just a condition. Actually, this is just a complication due to long elevation of blood sugar. It is a complication that comes about because of long time period of elevation of the blood sugar. So this condition, it's majorly found in people with diabetes mellitus type 2. It's majorly found in diabetic patients of type 2. Now, let us look at the signs and symptoms of such conditions. So, signs and symptoms. Signs and symptoms. The first sign and symptom we can talk about is polyuria. This is too much urination. So as there is too much urination, it leads to dehydration. Now this dehydration, you will find that there is dryness of the mouth. There is dryness of the mouth dryness, or even sometimes the skin. So when there is too much dehydration, the mouth becomes dry, and eventually you start feeling too much thirsty. So there is polydipsia. Polydipsia. This is feeling too much thirsty. Then also there is confusion. You start becoming confused. There is confusion. Then after getting confused, you start losing focus, loss of vision. So there is blurred vision or loss of vision. Blurred or loss of vision. So another sign we can talk about weakness or even paralysis. there is weakness. The patient will now be very weak. Then, or there is paralysis. Then, when you take the test, of course, the blood sugar will now be greater or equal to 600 milligrams per deciliter. This is equivalent to 33 millimoles per liter. So those are the signs and symptoms, our signs and symptoms of HHS state as it is found in diabetic patients. Then, so let us look at the causes of the HHS. What causes it? Causes of hyperosmolar hyperglycemic state. What makes somebody go in get this complication? What makes us get this complication as diabetic patients? Now, one, the first cause is the infections. Infections. You find that you can get infections like pneumonia. You can get like a pneumonia, even UTIs. You can get sepsis. So and so on. So the infection can trigger the coming of the HHS condition. Actually, almost it's like according to research, about 50 to 60% of people go into this complication, this condition. Most of these people, they get just because of infections. Then next, let us see now stopping medication. Stopping medication of diabetic mellitus. Stopping the medication, maybe you are on insulin, then you stop using insulin. You are supposed to use insulin at home. You were given an injectable drug. So instead of getting the injections, because you are feeling fine, you don't feel any problem with you, you stop using the medication. You end up getting such a condition. Actually, when you see about 21% of the people who get this who get this HHS, they get it just because of stopping the treatment or even poor treatment. So another thing, you can get this condition. You might be getting very good, the injection is very well, or you may not be getting, you have not got the infections, or you get some infection, you want to treat yourself, you take certain medications. There are certain medications which worsen the condition of diabetic patients. So you must use qualified health workers. When you buy drugs, buy from recognized places or where you know that somebody who owns this drug shop or clinic is qualified, such that you explain your problems. So as you are buying drugs, you also tell those people that, but I also have diabetes. Although you are giving me drugs for allergies, but I have also diabetes. So they will not give you drugs which will induce which will worsen the condition of diabetes mellitus. Which drugs? So there are certain drugs or certain medications. Let's just use medication. Certain medications worsen diabetes mellitus, hence HHS. Which drugs? For example, do you know such drugs? Okay, without wasting time, you know one? Mokembo, do you know one? Okay, without wasting time, let us mention these drugs. There are drugs like we have the corticosteroids, the corticosteroids. We have the corticosteroids. Then we also have the thiazide diuretics. Thiazide diuretics. Some people with pressure, some people with problems of too much fluid urination, like that. So they induce urination. So another one, there is the neurotics. The neuroleptics, and so on. So also we can have another cause of HHS is cardiovascular problems. Here, when we talk of the cardiovascular problem, we talk of the heart, the blood vessels, the heart, the blood vessels, like that. So problems which attack heart or blood vessels can also lead us to this HHS state. So without wasting time, let us continue and see the next part. So this is like an NB. So losing a lot of water will leave the blood concentrated. And this condition is called hyperosmolar. This condition will be called hyperosmolarity. So the condition whereby the blood is too much concentrated. It means that too much concentrated blood leads to a condition called hyperosmolarity. Now, hence the name hyperosmolar hyperglycemic state. That's what I wanted to talk about before we continue. So let us see the diagnosis. With diagnosis, you have to take off random blood sugar as the patient arrives to the facility. And this random blood sugar should be greater or equal to 600 milligrams per deciliter. We said it is equivalent to 33 millimoles per liter. So after seeing this, you have to check also for ketone bodies. both in urine and blood. So the ketone bodies in this case, here we are differentiating whether, because we might think it is HHS, yet it is DKA. We studied about DKA in our previous video. If you did not, you are not conversant with it, then it means that you must flash back to our previous video and know about DKA. So here we want to know, is it HHS or DKA? Now, if the ketone bodies are present, present in urine and blood, then it is not HHS. There are high chances that now this is DKA, diabetic ketoacidosis. If you want to know about diabetic ketoacidosis, scroll back to our previous video. It is our previous video which we are adding this one. So here it will be, here the results, they will not be present. So it will be either trace or none. But in most cases, there are no ketone bodies in this state. It is what differentiates it from DKA. So treatment. Now with the treatment, you just know that this person has lost fluids by too much urination. So he has lost fluid. So you replace fluids. We just say IV fluids to replace the lost, to correct dehydration. Then another thing, this person, he has lost electrolytes, especially he has lost the potassium. So you replace that. So also you give insulin or diabetic medication. So you again, if there is any underlying disease, so you treat the underlying disease.